Good morning and welcome. I am Josie Henderson. I am the Executive Director for the Oregon Public Health Association. Thank you all for coming. The agenda for today is that I'm going to talk just a little bit to give you some background on the Oregon Public Health Association. And then Katie's going to talk about our 2013 legislative priorities. We have some youth that we're really excited have come to Salem to talk about what they want to advocate in regard to public health today. And then there should be some time for questions at the end. The Oregon Public Health Association is an affiliate of the American Public Health Association. We have over 400 members, and we represent every part of Oregon and every sector of public health. Our mission is to advocate for the health of every Oregonian, so that's all of you, and that's why we're here today, is to fulfill that advocacy piece of our mission. We have a second piece of our mission, and that's about supporting public health professionals. So we do that so that they can help make sure that Oregon is a healthy place to live. We were founded in 1944, and so for nearly 70 years we've been the voice of public health in Oregon. During most of that time, and still to this day, most of the work of OPHA is done by a committed and hardworking group of volunteers, many of whom are here today in hearing room 50. One of those terrific volunteers is Katie Riley. Katie is a longtime public health advocate here in Oregon. She's a longtime OPHA member. She's also a past president of our organization and is the recipient of the Lifetime Achievement Award that OPHA gives out every year. She's going to talk to us today about OPHA's 2013 legislative priorities.
So OPHA has a process for identifying its priorities. We do have some general priorities that we've identified so far, but we have not identified any specific bills as yet. Our two top priorities, however, that we have identified are obesity and tobacco use. These are the two leading causes of preventable death in Oregon. Obesity is caused by a lack of exercise and poor nutrition. And so we want to have legislators support bills that will encourage amelioration of those kind of problems. Almost 62% of Oregonians are overweight or obese. Obesity can lead to different cancers. It can lead to cardiology problems, cardio problems, respiratory problems, and it also can lead to problems of stroke. So we want to prevent those kind of problems. Approximately 7,000 Oregonians are diagnosed with diabetes each year as well, and this is also brought on by overweight and lack of exercise. Tobacco issues are also a high priority for us. It's associated with a number of diseases, including cancers, respiratory and cardiovascular problems, and strokes as well. It contributes to 22% of all deaths in Oregon and is very costly. It costs taxpayers more than $2.4 billion per year in direct costs, as well as medical expenses and lost productivity. And approximately 35% of 11th graders have reported smoking in the past 30 days. 20% of adult Oregonians do smoke as well. So these are large problems for Oregon. In addition, OPHA is also concerned about improving health in other settings. We wish to have Oregon provide for healthy environments in homes, schools, and work sites. And we also would hope that we could have access to quality health care, and that includes mental health care, substance abuse treatment, school-based health centers. And then finally, we would also like Oregon to improve the prevention of disease and injury, and that includes prevention of substance use, prevention of teen pregnancy, and prevention of needless incarceration. And now we have students in different programs in our state who will talk about some specific problems and data regarding some of these issues. So our first student here will come and speak with you.
Hello, I am Frank Aoki, and I am from Liberty High School. And during car rides where one person has smoked, levels of fine particulate matter average 3 times higher than the maximum safe indoor air limit by the World Health Organization. And yes.
Hello, I'm Sarai Burrell, and I'm from Forest Grove High School. A typical 1-hour hookah session is equivalent to 100 or more cigarettes according to the World Health Organization.
Hello, my name is Mary Thies, and I'm from OHSU School of Nursing. And we would like to promote healthy environments by asking the legislators to consider the environmental health impacts of the proposed legislation.
Hello, my name is Jesus Ramirez, and I'm from Woodburn High School. Prevent inappropriate access to firearms. In 2010, there were 455 deaths in Oregon from firearms.
My name is Magdalena Rivas. I'm a junior from Woodburn High School, and I'm here to tell you that 22% of 8th graders and 28% of 11th graders in Oregon reported have suffered from depression. Thank you.
Hello, my name is Cristina Munoz, and I'm from Woodburn High School, and I'm a junior. I would like you guys to know that in the past 30 days, 23% of 8th graders and 36% of 11th graders has at least one drink of alcohol. Also, about 22% of 11th grader students in the state of Oregon report having used marijuana in the past 30 days.
Hello, my name is Claudia Diaz. I go to Woodburn High School and I'm a senior. I just wanted to say that school-based health centers are a vital piece of health care for Oregon's youth. Of school-based health centers patients, 81% reported they were unlikely to receive care that day if there was not a school-based health center available to them. And 80% reported discussing at least one prevention topic during their school-based health center visit.
Hi, my name is Julissa Ramirez, and I am from Woodburn High School. I am a sophomore, and I would like to talk about prevention and about incarceration. So studies have shown that education and prevention treatments of youthful offenders promote safer communities and are less expensive than incarceration. Thanks.
So that concludes the main part of our press conference. We do have some time for questions and answers if anybody has any.
Yes. As you may be aware, the state in September of this year, I believe, will be paying off the last of a bond using basically the National Tobacco Settlement, which frees up that money for the rest of the 2-year budget cycle. There is already a coalition that's proposed use of that money. I'm interested in knowing where your association has joined that coalition. I realize you don't have specifics yet, but where you have any ideas about how that money should be spent.
Do you want to take this one?
Sure. So the OPHA is a partner with the Tobacco Coalition of Oregon, and we'll be working with them regarding specific legislation. So we do support the need for having that directed toward prevention in particular.
The other question I had off the top was that earlier this week, Senate President Courtney called for a major infusion of money into mental health programs. And he also said that if the legislature can't find a dedicated source of money for the entire package, he proposes that at least the legislature should attempt to cover the smaller amount of money involved in covering people for under 25. I think that's the best way to phrase that. I wonder if you have any thoughts on that. I realize it's not a proposal he has, but it's certainly an advocacy he has, and whether there are specific programs within that. I know the governor's budget does contain amount of money, which also the Senate president's proposal will encompass those proposals, but are there any priorities within those programs?
Yes, we certainly support treatment of substance abuse and also mental health issues, and are very supportive of Senator Courtney's initiative on that. There's not specific legislation as yet. We also support prevention of substance abuse or substance use by adolescents, and having youth involved in positive programs such as those evidenced by the students we have visiting with us today from Hillsborough Boys and Girls Club and from the Woodburn Prevention Group as well. I think it really epitomizes how we would like to see youth occupied in terms of having positive activities during out-of-school time. Senator Courtney has also talked about the possibility of raising wine and beer tax, and that would certainly solve or work toward solving another problem. When you raise the cost of alcohol, this makes it more prohibitive for youth as well as others to use it, and it would help to solve some other problems as well, to prevent substance use.
I have a question about the youth group. Were all of these from Woodburn?
No, some are from Woodburn, and the first two speakers we had were from Hillsborough Boys and Girls Club.
Is it through Boys and Girls Clubs or health classes, or how do you recruit them? They're wonderful.
Well, we recruit them from, these different groups that we know about.
Oh.
Yeah.
Well,
Off camera, I'd like to get their names, but I don't
Sure.
mind spending the time.
We'd be happy to have them introduce themselves further. Yes.
I have a question. The USDA released their preliminary guidelines in terms of snacks, vending machines, food in schools. What is the association doing in terms of moving those guidelines along, and where does Oregon stand, if you know, in terms of legislation or just procedures in terms of vending machines and snacks that are sold at schools and other areas where youth come?
Didn't the legislature pass something
Yeah, I
earlier?
believe, I'm trying to remember whether that was the 2007 or 2009 legislative session. We have also supported in the past the Farm to School initiative, and I believe there will be additional legislation that will be considered regarding that this year. So we have certainly supported having healthy food served in schools and also in vending machines. And I think we've seen changes in what is served in schools as a result of that legislation, and also what's available in vending machines.
I understand that OPHA is one of the 60 or so members of Healthcare for All Oregon, and there's legislation in that regard too, LC 1914. You are supporting that, I assume, because you're a member of HCAO.
Yeah, we haven't gone through the process of supporting specific bills yet, but that one will certainly be considered. Yeah.
Thank you.
Yeah. Okay. If there are no other questions, thank you so much.
Thank you.